Welcome back, everyone. A lot of news coverage when it comes to the defibrillator in our public buildings, when you've got that cardiac moment or whenever the body shuts down. Technology has come a long way. Dr. John Shufeldt, my co-host today, and Mr. ER Doctor, we call him. And you've got all kinds of
all sorts
good
of
stuff here. Yeah.
Let's talk about the external defibrillator. You'll see a lot of these in airports, restaurants have them, schools, universities have them, and they're actually almost bulletproof. This is one we use for a training model at NextCare, and we train our staff with this. This is actually the pediatric version of this. You can see by a little cute little pink bear here.
Oh, cute.
If somebody is having a cardiac emergency, you can find these on the wall. They're very easy to use. You can pull them apart. You open them up, take them out. You'll see these little pads in there. It tells you where to put the pads on. You do that, and it's just really a 1, 2, 3 deal.
And you just turn it on?
You just turn it on, and the machine actually, the machine interprets what rhythm the person's in, and also determines if it needs a shock. And then it will tell you in a little screen right here if the person needs to be shocked.
And
if
what
their
do
heart
you
needs
do
to be
then?
defibrillated.
Do you press that button?
Press the button, and they get shocked.
This one's the shock
It's
button?
actually these two buttons right here.
Oh, wow. And
Right.
this is just for babies. Now,
Well, this is the baby. These are the baby paddles, and then there's adult paddles in here as well.
what happened to the big things that look like two ironing boards where you go?
Well, the old ER shows where
Yeah.
and they rub the things together. They've kind of been replaced by a lot of this. We'll look at some other things here.
See, I'm so behind the times in technology.
You've got to update your TV programming.
That's what we're doing right here today.
Amen.
Okay.
So here's a defibrillator. We use this at Native Air, and this is there's a ventilator we use at Native Air, and this little thing here is one after the patient gets intubated. I talked with Bob a little bit about that. So when you put a tube down the person's mouth,
Right.
that's an endotracheal tube, and you put it in, and paramedics will put it in, or we'll do it in the emergency department. You hook them up to a ventilator, and so the ventilator basically breathes for them, so you don't have to sit there and do that whole bag thing.
So it's a portable ventilator.
It's a portable ventilator, and this actually is a portable ventilator that we use. For example, at Native Air uses this, and when we're transporting a patient that's on a vent, we just use this little thing.
That is amazing.
It's
so little.
right. It plugs into the ship. It also has batteries, and it works extremely well. You know, we also talked about some of the cardiac drugs. And this is a little mini-med pump, and this holds 3 different medications. So a lot of the medications you give, you have to give over time. And so it's called the IVAC version, and you program this to what sort of rate you want the medication to go in. You turn it on, and it pumps the medication from the IV bag through the IV tubing into the patient's arm, for example.
So this is, again, portable IV unit.
Portable
So
IV, portable IV pump
meds.
unit. Exactly. And get the exact right dose with the exact right time.
And you know, it's really interesting as you were in the ambulance, and also same with AirVac. I mean, you have this very confined space, so obviously you can't take a whole hospital with you and fit it in a helicopter.
Right. For Native Air, we tell them they need to do a lot of things they do before they actually start transporting, because if you ever see the inside of those helicopters, they're less room than the ambulance, and there's not a lot of room to manipulate once the patient has a problem. So this is another little cardiac monitor. And we watch the patient's heart rate with this. And this again, you can hook it on the side of a bed. We transport people in the emergency department with this. And for example, in the pre-hospital portion of it, it's called the ProPack. That works very well. And then lastly, I thought we'd teach you how to suture.
You know what? I'm not a very good seamstress, but I can sew an arm, no problem.
Here's a little fake arm that we'll use for the residents in some of their training modes. And actually, suturing is relatively easy.
Oh, my stomach. Okay.
All right, here we go. You ready?
Yep.
Little needle.
Wait, I'm left-handed. Does it make a difference?
No. Okay, you want me to demonstrate one for you?
Yeah, do one. Okay.
So basically, it's relatively easy. You just hook this little puppy in here like this, and just go right through the skin like that.
Oh, God.
And pull it out like this, and then we'll tie one, and then you can do it. So that's how easy it is. And you just tie it like that.
It's kind of like fish hook. Whoa. Well, look at that loop-de-loop knot.
See how easy that is?
Yeah.
All right.
Okay. So in an emergency, okay.
So an emergency, hang on, let me thread this thing for you, because if you stick yourself, we'll be in trouble.
Okay. Yeah.
The union will come after me.
See, it's got a little. It is like a fish.
It's a fish hook. Yeah.
Okay. Hang on.
Maybe here we can turn this thing around.
Oh yeah.
There we go.
See, the world is not made for lefties. Okay, whoa.
That's one way to do it. That's not the right way, but yeah, just grab the needle.
Uh-oh, wait. Oh, I got to do it again. Hang on. Hey, this is hard.
You can adjust the needle in that I'm sending back, because I'm afraid you're just going to
Oh, here we go. Ah, crud.
push that right in.
Tom, it's going to be okay. Hang on a minute. Okay, I'm going to do this one more time. I've just gouged him.
We can.
I got it.
Yeah, just pop that out of there. Then you have to let go with your other hand. Good.
Okay, there you go. Ladies and gentlemen, it's a fine suturing.
You've seen it here first.
Okay.
Great job.
I'll let you tie it up, okay?
Thanks.
No, this is great information. Thank you, Dr. John.
Oh, Hey, well, we're back with Anne-Marie Kruger from Arizona Poison Control. Welcome.
Hello, it's nice to be here.
I'm not sure if people realize this, that physicians call you guys all the time and ask for advice and talk to the toxicologists.
Hundreds and thousands of times a year.
So tell us, how can someone get a hold of you first off?
First of all, they can call us at 1-800-222-1222, which is a new national number that no matter where you are in the United States, if you call that number, you will get your closest local poison center. And that's for the public as well as the medical professionals.
Okay. Okay, why don't you repeat that number one more time, real slow.
1-800-222-1222.
All right, let's take a look at some of your little friends here. Scorpions are a big deal in the summer here in Arizona. And I think a lot of people have been bitten and stung by scorpion. Luckily, I haven't, and I won't pick up this little guy. So what do people do when they what happens to people when they get bit by a scorpion?
Well, they get stung by a scorpion rather than getting bit. But they there are 57 different kinds of scorpions in Arizona, and this is the only one that has a neurotoxic effect to the body. And it is instantaneous pain and numbness and tingling. And then it's very normal for the pain and numbness and tingling to move. Like if you're reaching up into your cupboard to get something and it stings you on the finger, it's very common for that pain and numbness to move all the way up to your shoulder. And it's also very common for if you step and get stung outside by the pool at night.
Right up your leg.
Right up your leg, you bet.
But luckily, very few people die from scorpion stings. I mean, it's in the one in every few years at the very most.
Absolutely.
Okay. Neurotoxins for scorpions or antivenom for scorpions, where are we with that right now?
There was, of course, an antivenom made at ASU that they have discontinued making.
Right.
So we are trying to bring one in from Mexico because Mexico has 12 different scorpions that are this neurotoxic component. And they have developed a really good one.
Excellent.
But we've never had a Mexican antivenom be approved before by the USDA.
Here, yeah. Hey,
so we're trying hard.
Let's bring in Russ from the Phoenix Herpetological Society. Did I pronounce that right?
PHS.
PHS, that's much easier. Well, thanks for coming down. Let's go over and show us kind of what you brought down here.
Okay, well, we brought
some of my little friends.
3 of the most common rattlesnakes you're going to find in Maricopa County. The diamondback, western diamondback, which is #1 as far as prevalence in Maricopa County. You've got the Mojave rattlesnake, which is considered our most lethal because it has 2 types of toxins that it can carry. And the other one is the black-tailed rattlesnake, which is at our higher elevations, such as Troon at Scottsdale, at McDowell Mountains, things like that.
Okay. Now, I've treated a lot of rattlesnake envenomations, and more often than not, they're not typically a huge deal. A lot of times people have a dry bite, or they have a bite that does not give them a lot of venom. I guess initially, how do you tell the difference?
Well, you know, the hospital flat tell you let them make that decision.
Right.
They're going to take blood pressure and everything like that. So, but you're going to have instant swelling if you are envenomated, a lot of pain immediately. So, best thing to do is let the medical people make that determination whether you've been envenomated or not.
Right. You should always go in. Is there some certain times of the year that are more likely to have a dry bite than not?
You know, not really. In the beginning of the year, when they're first coming out of hibernation, they're anxious for a meal, and the boys are looking for a girlfriend, so they're a little bit maybe testier. But other than that, you know, if you just get a quick bite, a lot of times they'll just give you a hit, and we are fortunate that sometimes 1 in 3 bites are actually a dry bite, and no envenomation takes place.
Now, a lot of the bites I've seen, I would say the majority of them are by people doing something kind of not the smartest thing. I have pictures of a guy kissing a rattlesnake, and then the next picture I have is the guy dead on the autopsy table. People tend to taunt these things, and a lot of times you're like, well, what were you thinking? You're playing with a rattlesnake.
Yeah, you know, we do a lot of education trying to keep kids from doing that. If you want to watch them, that's fine, but they don't need to be approaching them. Nobody should be approaching these things. I mean, they're wild animals. They got the brain the size of a pea, so they don't know affection. All they know is how to protect themselves. You're bigger than them, so they're afraid of being endangered, so they're going to defend themselves naturally. So don't handle them.
And even you as an expert doesn't handle them. I saw you brought your stick with you.
Yeah, our snake tongs. We're required, our members are required to use snake tongs. We're not to free handle them on the rattlesnakes at all. You're just asking to get bit.
Well, let's take a look at your other little friend here, the Gila monster.
Yeah, I had to come in here.
Yeah.
Hi, how you doing,
Hi.
Russ? This is really
yeah, this is Hermie. This is a Gila monster, and these are protected and restricted in the state of Arizona, so I have to have a permit to have these. Anybody who touches one of these, pokes, prods, or antagonize anyway has broken state law. So these guys are very, very cool lizards, but they do bite. They've got tremendous jaw pressure, and they do have a venom. They chew it into your into the wound, and it can be extremely painful. Nobody that I know of has ever died from one. Doesn't mean you didn't want to.
I'm not sure if I've ever even seen anybody bit from one of these things, but I remember just from reading from my board exams that once they lock onto you, they are extremely hard to get off.
They're the bulldogs of the reptile world. I mean, they just get a hold of you and they chew and chew and chew, and it's out of fear, and it's a very powerful bite as far as jaw pressure goes, and they have extremely sharp, grooved teeth, and the venom comes out of a lower gland in the jaw, and it coats the teeth, and that's where the venom comes from. But it's extremely painful, extremely strong bite.
Well, much like a pliers.
Pliers with teeth. Yeah, pliers
Ouch.
with teeth. Yeah.
Okay.
Stay away from those.
Yeah. By the way, does this guy have a name?
Hermie.
Oh, Hermie is the, okay.
Yeah, Hermie.
Gotcha. Well, that's a nice abbreviation.
Yeah, yeah.
Ugh. Do you like snakes?
You know, I don't. It's funny, when people come to the emergency department, they almost always bring the snake with them, and I don't know why they do it. And I'm like, do you want to see it? Not really. Thanks, though. No, it's okay. One more thing. Dead snakes are still a problem.
You know, with a rattlesnake, somebody kills a rattlesnake, and they get an involuntary muscle contraction, and when the mouth opens, the fangs extend, and once it comes down, that muscle squeezes the venom gland, and you can be envenomated by a dead snake. So you know, that's the problem we have. We get people doing it all the time.
A lot of good information. Yeah. Good. All right. Thanks, guys.
All right. Thank you.
Whew, stand back. Okay, we're going to put a wrap on our show in just a moment, and also give you a sneak peek at what's coming up tomorrow on Your Life A to Z. We'll be right back.
One place where you won't get bitten by a snake on a Norwegian cruise line.
We hope not.
Amen.
No way. Hey, this has been a great show. We want to thank all of our guests. Hey, Phoenix Fire, I know you work with them a lot. They're phenomenal, aren't they?
They do a great job.
All right.
Poison control, you call them up, you talk to a toxicologist in a blink of an eye. Great set of group, great set of people.
ER and learning how to suture. I'm going to work on that technique, right?
Next time.
Yeah. Okay, let me ask you,
Like
right. Let me ask you one quick question, though, John. What would be the best tip or the best piece of advice you can give somebody right now in 30 seconds or less on dealing with an emergency?
I think the best piece of advice is just simply not to panic. Like Bob Kahn said, if you call 911, they can really walk you through a lot of problems.
Okay.
And so don't panic.
All right. Thanks a lot, John. We'll see you all tomorrow. Have a good day, everybody. Bye-bye.